Hello, my dear friends. I hope you are well. Today we want to talk about myocardial infarction, and finally I want to explain to you the nursing diagnoses and necessary actions for each of them. So, without wasting time, let's get to the point. Myocardial infarction. 1. Definition of myocardial infarction. Myocardial infarction, MI, refers to the irreversible necrosis of cardiac myocytes resulting from a critical reduction or complete interruption of coronary blood flow, leading to severe and prolonged myocardial ischemia. Most common cause: rupture or erosion of an atherosclerotic plaque, platelet activation and thrombus formation, acute coronary artery occlusion. Two, pathophysiology, disease mechanism. Atherosclerosis of the coronary arteries, plaque rupture or surface erosion, activation of platelets and the coagulation cascade, formation of an intraluminal thrombus, reduction or cessation of coronary blood flow. Prolonged ischemia leading to myocardial necrosis, typically within 20-30 minutes. 3. Types of myocardial infarction. A. ECG-based classification. 1. ST elevation, myocardial infarction, STEMI. Complete coronary artery occlusion. ST segment elevation on ECG. Requires immediate reperfusion therapy. 2. Non-ST elevation myocardial infarction, NSTEMI. Partial coronary artery occlusion. Absence of ST segment elevation. Elevated cardiac troponin levels. B. Universal definition of myocardial infarction. Type 1. MI. Spontaneous MI due to atherothrombotic plaque rupture. Most common type 2. MI. Imbalance between myocardial oxygen supply and demand, e.g. anemia, sepsis, tachyarrhythmias, hypotension. Type 3. MI. Sudden cardiac death with symptoms suggestive of ischemia before biomarker measurement. Type 4. MI. PCI related. Type 4A. MI related to percutaneous coronary intervention. Type 4B. Stent thrombosis. Type 5. MI. MI related to coronary artery bypass grafting, CABG. 4. Clinical presentation, typical symptoms: retrosternal pressure-like or crushing chest pain, radiation to the left arm, jaw, neck, or back, cold diaphoresis, nausea and vomiting, dyspnea, sense of impending doom. Atypical symptoms, particularly in elderly patients, women, and individuals with diabetes: generalized weakness, syncope, epigastric discomfort, dyspnea without chest pain, profound fatigue. 5. Diagnostic methods for myocardial infarction. 1. Electrocardiography, ECG, ST segment elevation, ST segment depression, T-wave inversion, pathological Q waves. 2. Cardiac biomarkers, high sensitivity, cardiac troponin, I or T, most sensitive and specific biomarker, rises within 3 to 6 hours, remains elevated for 7 to 14 days, CKMB, useful for detecting reinfarction. 3. Echocardiography, regional wall motion abnormalities, RWMA, reduced left ventricular ejection fraction, EF, identification of mechanical complications. 4. Coronary angiography, gold standard diagnostic modality, defines location and severity of coronary obstruction, enables simultaneous therapeutic intervention, PCI. 5. Advanced cardiac imaging, cardiac MRI, infarct size assessment, myocardial viability, coronary CT angiography, selected clinical scenarios, nuclear imaging, SPECT, PET, ischemia, and viability evaluation. 6. Complications of myocardial infarction. Acute complications: arrhythmias, VT, VF, AV block, cardiogenic shock, acute heart failure, papillary muscle rupture, acute mitral regurgitation, ventricular septal rupture, free wall rupture, cardiac tamponade, acute pericarditis. Chronic complications: chronic heart failure, left ventricular aneurysm, intraventricular thrombus, chronic arrhythmias, Dressler syndrome, post-MI pericarditis. 7. Management of myocardial infarction. A. Acute, emergency management. 1. MONA-B, morphine, oxygen, if SpO2 90%, nitrates, aspirin, beta blockers. DOIS, antiplatelet therapy, aspirin, P2Y12 inhibitors, o clopidogrel, o ticagrelor, o prasugrel. 3. Anticoagulation, unfractionated heparin, low molecular weight heparin, enoxaparin, bivalirudin. 4. Reperfusion therapy, primary percutaneous coronary intervention, PCI. First-line therapy in STEMI. Door-to-balloon time. 90 minutes fibrinolytic therapy. Alteplase, tenecteplase. Used when timely PCI is unavailable. B. Long-term pharmacologic therapy. Secondary prevention. 1. Beta blockers. Metoprolol, carvedilol. 2. ACE inhibitors, ARBs. Enalapril, ramipril, losartan. 3. High-intensity statins. Atorvastatin, rosuvastatin. 4. Aldosterone antagonists. Eplerenone, spironolactone. 5. Dual antiplatelet therapy, DAPT. Aspirin plus P2Y12 inhibitor. Minimum duration, 12 months. C. Non-pharmacologic management. Smoking cessation. Optimal control of diabetes, hypertension, and dyslipidemia. Mediterranean diet. Structured cardiac rehabilitation. Supervised physical activity programs. 8. Multidisciplinary approach. Cardiology and interventional cardiology. Coronary angiography and PCI. ICU and critical care medicine. Shock management, arrhythmias. Nephrology. Acute kidney injury. Renal dosing of medications. Endocrinology. Glycemic control. Clinical pharmacology. Drug interactions and optimization. Rehabilitation and nutrition services. Palliative medicine, advanced or end-stage disease management. 9. Summary. Myocardial infarction is a life-threatening medical emergency in which early recognition, rapid diagnosis, timely reperfusion, and comprehensive multidisciplinary management are critical to reducing mortality and long-term morbidity. Advances in diagnostic modalities, interventional cardiology, and evidence-based pharmacotherapy have significantly improved patient outcomes. Nursing diagnoses in myocardial infarction and nursing interventions. 1. Decreased cardiac output, related to impaired myocardial function, decreased ventricular contractility, cardiac dysrhythmias, myocardial ischemia and necrosis, evidenced by hypotension, tachycardia or bradycardia, reduced ejection fraction, EF, decreased level of consciousness, oliguria, cool, clammy skin. Nursing interventions. Continuous monitoring of vital signs and mean arterial pressure, MAP. Continuous cardiac rhythm monitoring, telemetry. Strict intake and output monitoring and daily weight measurement. Assessment for signs of cardiogenic shock. Administration of oxygen therapy as prescribed. Preparation for inotropic support, e.g., dobutamine, as ordered. Immediate reporting of hypotension or rhythm changes. Maintaining bed rest during the acute phase. 2. Acute pain related to myocardial ischemia, stimulation of cardiac nerve endings, evidenced by patient report of chest pain, anxiety, diaphoresis, increased heart rate and blood pressure. Nursing interventions. Assessment of pain intensity using a standardized pain scale. Administration of nitroglycerin according to protocol. Administration of morphine if pain is not relieved. Monitoring blood pressure before and after nitroglycerin administration. Reduction of environmental stimuli. Positioning the patient in a semi-Fowler position. Educating the patient to report recurrence of chest pain immediately. 3. Impaired gas exchange related to left ventricular failure, pulmonary edema, decreased pulmonary perfusion, evidenced by dyspnea, decreased oxygen saturation, SpO2, crackles on lung auscultation, respiratory distress and anxiety. Nursing interventions. Monitoring SpO2 and arterial blood gases, ABGs, administering oxygen therapy as prescribed, positioning the patient in Fowler or semi-Fowler position, assessing for signs of pulmonary edema, preparing for non-invasive ventilation, NIV, or mechanical ventilation if indicated. Collaborating with the physician for diuretic therapy. 4. Risk for dysrhythmias related to myocardial ischemia, electrolyte imbalances, infarct-related myocardial scarring. Nursing interventions. Continuous ECG monitoring, monitoring serum potassium and magnesium levels, early identification of ventricular tachycardia or ventricular fibrillation, ensuring availability and readiness of defibrillation equipment, adhering to ACLS protocols, minimizing unnecessary patient stimulation. 5. Activity intolerance related to decreased cardiac output, fatigue, heart failure, evidenced by dyspnea with activity, tachycardia, decreased oxygen saturation during exertion. Nursing interventions. Assessing cardiovascular response to activity. Implementing a gradual, progressive activity plan, assisting with activities of daily living, ADLs, teaching energy conservation techniques, discontinuing activity if chest pain, dyspnea, or significant vital sign changes occur. 6. Anxiety related to life-threatening condition, chest pain, ICU environment, lack of knowledge about the disease process, evidenced by restlessness, increased heart rate, verbalization of fear or fear of death. Nursing interventions, establishing a therapeutic nurse-patient relationship, providing clear and simple explanations of procedures and treatment plans, maintaining a calm and reassuring presence, facilitating family presence when appropriate, collaborating with the medical team for anxiolytic therapy if indicated. 7. Risk for ineffective tissue perfusion, cardiac, renal, cerebral, related to decreased cardiac output, hypotension, shock states, nursing interventions, monitoring neurological status and level of consciousness, monitoring urine output and renal function, e.g., creatinine levels, ongoing assessment for recurrent chest pain, positioning the patient to optimize tissue perfusion, promptly reporting any acute changes to the healthcare team. 8. Risk for bleeding related to anticoagulant therapy, thrombolytic therapy, dual antiplatelet therapy, DAPT, nursing interventions, monitoring for signs of bleeding, gums, urine, stool, puncture sites, assessing and monitoring vascular access and catheterization sites, monitoring hemoglobin, hematocrit, and platelet levels, avoiding intramuscular injections, educating the patient about warning signs of bleeding. 9. Disturbed sleep pattern related to pain, anxiety, ICU environment, nursing interventions, reducing nighttime noise and light, coordinating care activities to minimize sleep interruptions, managing pain prior to sleep, providing emotional support. 10. Deficient knowledge related to new diagnosis of myocardial infarction, complex treatment regimen, nursing interventions, educating the patient about myocardial infarction and warning symptoms, teaching correct use of medications, e.g., nitroglycerin, DAPT, educating about lifestyle modifications, emphasizing the importance of cardiac rehabilitation, reinforcing the need for regular medical follow-up. 11. Risk for hopelessness, depression related to chronic illness, functional limitations, fear of recurrence, nursing interventions, screening for depression, referring to mental health professionals when indicated, providing emotional support, encouraging family involvement, collaborating with palliative care services when appropriate. Nursing summary. Nursing care of patients with myocardial infarction requires accurate hemodynamic monitoring, early detection of complications, rapid evidence-based interventions, ongoing patient and family education, active participation in a multidisciplinary healthcare team. The role of the nurse is essential and irreplaceable in reducing mortality, preventing complications, and improving patient outcomes and quality of life. I sincerely thank each and every one of you for joining me in this training. Thank you very much for supporting us by liking and subscribing.